Now, SRL Diagnostics is part of Fortis Healthcare, and typically when we look at a diagnostic company, we are valuing it independently. And post the Pharmacy Therocare deal, there is definitely an excitement in the entire diagnostic space. But what's happening to one of India's biggest diagnostic change? It always gets morphs under Fortis Healthcare, and that's the point I want to just bring out for our viewers, that when you are valuing Fortis, remember to value the value of SRL Diagnostics also, because most of the diagnostic business in India is such that it is growing in double digit. It throws a lot of cash. It's a high ROC business, but is this business likely to get disrupted given that you got a player like Pharmacy which is now entering the market? Anand, good morning. Thank you for joining us. Has COVID changed the diagnostic business in India suddenly? It all started with this famous RT-PCR test, and then we all are getting more conscious. And earlier, when somebody would prick a needle, I would say, ouch, but now I'm accepting the pain because it's for my welfare.
Yeah, good morning. Thanks. So, as you rightly pointed out, yes, COVID-19 pandemic has had its impact on the diagnostic industry as well. Overall, if you see in healthcare, we've always talked about healthcare workers as doctors and nurses. Very few people had idea of lab being at the forefront of any disease management, at least in the public level, even though doctors know it. So, but this pandemic has put the lab at the forefront, and the lab technologists and phlebotomists are also considered as COVID warriors and, frontline healthcare workers. So this has brought more focus on the industry. And since RT-PCR, the test, treat and track strategy has been one of the key pillars of management of COVID. So this has led to, even more awareness across the country about diagnostics. One is awareness. Second is about, what quality really means. Earlier, people were looking at any lab, any neighborhood lab, and they would go there. But now people are aware that what does an accreditation mean? What does an approval mean and all that? And they are looking at accredited players to go and work with. So that is another change which we are seeing in the consumer behavior. So, and also we are also seeing changes like people want to access services from home. So the home-based services are increasing. So we get more home collection requests. And we also see during the phase between, when we see the first phase and the second phase of the pandemic. So we saw that, the people have a greater awareness and they want to do more preventive health. So the uptake of preventive health packages were also higher during that period.
How much of the needle moving COVID business do you think is not permanent? As of now, we know that labs are working overtime, they're burning midnight oil. That effort is also getting translated into revenue. But when COVID comes down, what happens to the COVID revenue, whether it is RT-PCR or getting a CRP tested or getting an interleukin test?
Right. So actually, last year, if you see, we have done about almost 23% of our revenue came from COVID. And we have done, overall, we have done about, in last year, we've done about 2.5 million RT-PCR tests, one of the highest in the country. So, but as we see going forward, that, now that the second wave is, tapering down and, the chances of a third wave is still in discussion. So we have sense that, the COVID pandemic will probably continue in sporadic phases for the next 12 to 24 months, whereby then it will probably change into an endemic. So, which means is that, it will continue to be, the testing requirement will continue to be there. So you will have, just like how you have HIV and hepatitis testing for pre-operative requirement. So you will also have, as a pre-admission requirement, COVID testing. And since people will continue to travel across different geographies, you will see screening requirements for COVID being always there. So I think that's how it will pan out in the next 2 to 3 years. And we don't see any situation where we'll have zero testing happening or where we'll have a zero positivity kind of a situation. So there will be some amount of minimal sporadic, surges of viral activity, because we also know that this virus is mutating. It's continuously mutating, and it's very difficult for us to predict which way it will go. But the requirements, whenever there is a COVID infection that's happening, the requirement for other parameters like IL-6, D-dimer, CRP will also continue. So these requirements will continue in parallel whenever we have COVID testing requirements as well.
Anand, the USP which ThyroCare chairman Mr. Velumani shared with us is that, look, I go for size, I'm more B2B, and I believe in bringing costs down, but expanding the scope and size. When I speak to Amira Shah, she is like, I'm there for classes, and I'm going to be moving up the value chain by adding more and more specialized tests which are only done by hospitals right now. Where do you stand? Because you do have a mothership, which is your hospital, and then you do have your collection centers. Which path are you likely to walk on?
Right. So SRL is the second largest laboratory chain in the country in terms of revenue. But in terms of network, we are the number one in terms of network. We have the largest network of laboratories. We have 426 laboratories across the country now. And we have an equitable distribution of our services across the country. So some certain chains are more focused on north, some are more focused on west and south, whereas we are sort of an equitable distribution across all geographies. And with this network, what we feel is that we are not just into B2C or B2B, we are in both the spaces. Sort of, our business is actually distributed evenly between B2B and B2C. So we have collection centers, we have home collections, we also do a lot of walk-in patients coming into our centers. We also have people accessing us through digital platforms. At the same time, we also have hospital partners, we have hospital lab management projects, we have public-private partnerships with states like Jharkhand and Himachal Pradesh. So we also do international business, and we also have a small portion of radiology as well in our overall component. So we are sort of a full service laboratory chain. And we also have to see here that, the Fortis hospitals overall contribution to our revenues is about 11%. So beyond that, we have all this, business coming in.
Okay. Anand, how much of your business you would say is more commodity? The challenge with a commodity business is it's like a diabetes test or a thyroid test, or even for that matter RT-PCR. You may gain in terms of reach, but the prices are coming down. I mean, a diabetes test today is done for less than 250 rupees. A hemoglobin test is now done for as less as 150 rupees. How much of your business qualifies into size, but no margins, and prices will keep on coming down?
So there are certain tests which tend to get commoditized because of the requirement across geographies and a lot of people looking at it as a routine parameter, and there is more of self-testing happening there, and also they are part of preventative health packages. So these are the reasons some of the tests gets commoditized. But at the same time, interpretation of these tests require specialized doctors who need to work on it. So commoditization will happen at the first level of testing, but at the second level of testing, they will always require a laboratory which has got those kind of doctors and those kind of infrastructure which can interpret such tests and give the reports. For example, a simple test like hemoglobin, it may be like, you can go to a testing center and get anywhere and get it done, and you may find that your hemoglobin is low. But why is it low when you want to investigate further? That is where labs like SRL come into play. So there is some amount of commoditization which can happen, but it is not something which is going to destroy the whole industry, or it's going to be completely commoditized across all platforms. So that kind of situation is not there. And any commoditization will lead to some amount of price pressure. But as we know, volumes keep going up, and which also means that we'll be able to procure at much better costs from our vendors. And that will definitely help us in keeping our margins intact.
Okay. Fair enough. So, given that we've continued to see business steady at this point of time, and going forward, of course, with some apprehension around the third wave as well, how are we best prepared for that this time around, Mr. Anand? I mean, last time it was overwhelming, and And even the best of chains were struggling to keep up with the demand. What do you anticipate now going forward, and in terms of preparation or in terms of the number or scale that you have, is it well sort of well set to deal with any such requirement?
Right. So during the second wave, we did face some challenges. As we started this COVID testing somewhere around end of March 2020, we had only 2 labs across the country doing COVID testing, RT-PCR testing. Currently, we have close to about 17 labs across the country. And, the capacity also during the second wave, we found that it was one of the important factors. And we need to increase capacity in the existing labs as well. So we had increased the capacity to a large extent across these labs. And I think that we are much better poised to face the third wave. And, especially in pockets we are also expanded our network into the rural India so that we are able to manage situations in all kinds of geographies. We have labs which can handle samples in the range of 3,000 to 5,000 per day. So those kind of labs we are positioned across the country. So which makes it probably an easier way to handle this kind of workload. At the same time, we've also introduced some technologies like rapid RT-PCR testing, equivalent to RT-PCR testing, so which can be used when there is an emergency, when you need to work on something on patients who need to be admitted immediately. So those kind of requirements also, we have set up some rapid testing labs where we can provide reports in 15 to 20 minutes as well. So these kind of combination of testing of rapid RT-PCR as well as routine RT-PCR helps us in a better way to handle the third wave.
Okay, what about tie-ups going forward? I mean, what are you looking at? Anything you can share with us, given that there is anticipated, further action in the pharma universe? Is there anything on the cards or anything you feel would be beneficial, even in terms of collaborations going forward?
Right. I think this is a very important moment for the diagnostic industry, in the sense that, this is a highly unorganized industry with only about 15 to 16% of the industry with the organized sector. So there is a large scope for consolidation, and the pandemic has also fast-tracked this process, whereby the requirements are huge, and the players are not able to manage in the unorganized sector. So the scope for consolidation is very high, and we feel we are looking at opportunities for acquisitions where we can grow inorganically by acquiring existing practices and how we can build on them. And also looking at organically grow both in the digital as well as physical space in terms of bringing out the advantages of the digital transformation, which has been fast-tracked due to the COVID. And how do we actually capitalize on the changes in the consumer behavior, where they are looking at using more of digital media, as well as using home collections as one of the options for their testing requirements. So with the blend of these, as well as both organic as well as inorganic modes of growth, I think we are poised to have a much better years going forward. And what we also see is that, in the last 3 years, the industry has grown by about 11 to 12% CAGR. And we hope the trend also continues for the next 3 to 5 years is what we are expecting. But the growth is more dependent on how we actually are able to serve our patients and how we are able to be available for them at various touch points that they are going to look out for.
Okay, I'm looking at a market-dominated question. The current market cap of Fortis is about 20,000 crore. The current market cap of Dr. Pathlab is, when I look at it, it's only I realize that what is the market cap. It is 28,000 crore. The market cap of Metropolis is 20,000 crore plus. Does it make sense to list SRL Diagnostics separately and unlock the value? Because it is part of Fortis, it is not getting captured. Is that a thought which the board has? Is that the thought which you think is the right thought?
So we are continuously evaluating options of how do we actually create value as well as unlock value which is there in the system for all our stakeholders. And this process is in discussion with the board, and we'll come up with with relevant options in the near future.
You cannot see me, but when I asked you that question, I captured a smile on your face. So am I thinking on the right track?
So I see we are looking at options to increase our value proposition, and how do we actually unlock value which is there in SRL. So the options are being looked at. So the board will definitely come up with something which will be the right way to go forward.
Closing questions. The big change in the diagnostic space has been the unorganized market move to the organized market. How much of that change in last 2 or 3 years you think is still going to happen? What I'm trying to understand from you, large part of unorganized market has moved to organized market already in last 3 years. Will the same rate continue in future as well?
Right. So the growth actually happens in two different ways for the organized players. One is by taking over market share from the unorganized sector. Another is building their own market share, increasing the market size in terms of creating new products and offerings for the consumers. And on the third side is acquiring certain practices in the unorganized sector and then consolidating. So these three activities have been continuously and parallelly happening over the last 3 to 5 years. And I think this activity will be further fast-tracked in the coming years. And not only that, labs like SRL will also be focusing more on next-generation diagnostics. So we are looking at how we can actually improve not only on the preventive health side, but also on how we use technologies like genomics, mainly in the field of reproductive medicine, oncology, and inherited metabolic disorders. So these are the areas where we feel that genomics will play an important role, and we are investing heavily into this and also building our capacity, which we see next generation diagnostics as one of the future requirements.
And it's the first time I've interacted with you on this forum. We keep on interacting with lot of CEOs and doctors of Fortis on various forums. So it's just been a pleasure interacting with your group and doctors and some of the fine professionals there.
Thank you. Same here.